Hi everyone! So for this Ask the Dietitian question, someone asked what is the difference between a dietitian and a nutritionist? So I have a graphic that I'm going to share on the screen that's going to go over it, and I'm going to explain it in a little bit more detail. So the title dietitian, registered dietitian, or registered dietitian nutritionist is protected by law. The title nutritionist only is not protected by law. So as dietitians, we are regulated by a governing body called Commission on Dietetic Registration. And this governing body really determines what we can do as dietitians within our scope of practice. However, anybody can claim to be a nutritionist because there's no formal governing body just regulating this term. To be a dietitian, you have to go through a minimum education of a bachelor's degree, which is 4 years of undergraduate education. And then you have to go through a 1,200-hour supervised practice experience, usually an internship, that involve the areas of clinical nutrition, food service nutrition, and community nutrition. If somebody is claiming to be just a nutritionist, they might not have gone through formal education required for their credentials. To be a dietitian, you have to maintain continuing education requirements. So every 5-year cycle, we have to maintain at least 75 hours of continuing education. For just nutritionists, they are not necessarily required to have continuing education requirements. So they're not even required to be familiar with the current evidence-based practices in nutrition like we as dietitians are. Dietitians can work with anybody who is healthy or sick. We can prescribe medical diets to clients, and people that are claiming to be nutritionists, if they don't have the credential of dietitian, they are not legally able to prescribe diets or meal plans to their clients. So as dietitians, we can prescribe individualized meal plans to our clients and give them medical diets to help them manage their chronic conditions. So we are able to practice something called medical nutrition therapy, which could be eligible for insurance reimbursements. Just nutritionists are not able to practice medical nutrition therapy, so their services are probably not going to be able to be covered under insurance. And lastly, a dietitian is legally considered to be a nutrition expert. Somebody who is just claiming to be a nutritionist that doesn't have the dietitian title, they might consider themselves as a nutrition expert, but they are not legally considered the nutrition expert. Most of them are self-proclaimed. So hopefully this helped y'all understand what the difference between a dietitian and a nutritionist is. So something I want you to remember is all dietitians can be nutritionists, but not all nutritionists can be dietitians. So the next time that you're looking for dietary advice or you're looking to work with somebody on your nutrition habits, make sure that you're looking for somebody who is credentialed as a dietitian. So I am a registered dietitian nutritionist, and I am able to provide you with nutrition advice. So if you want to work with me and schedule a nutrition counseling session, I've provided a link below for you to do that.